Hi, everyone, and welcome back to Gratuity. I'm your host, Darin. Thank you to everyone who's reached out. We really appreciate the support. If you want to get involved with the show, please email us at gratuity@tastemade.com. We are absolutely honored to be joined by two incredible organizations today, Help Feed the Frontline LA and World Central Kitchen, who have joined forces to make meals and distribute them for many people on the front lines in Los Angeles. This includes doctors, ER workers, nurses, paramedics, anyone who is out there just fighting the cause, helping people stay healthy, helping people get healthy. They are feeding them. We have Tim Kilcoyne, who's the chef operations officer over at World Central Kitchen. And we have Brooke, Williamson, and Erin, who are part of the group of Help Feed the Frontline Los Angeles. So please sit back and enjoy some gratuity. Brooke, Erin, and Tim, thank you so much for joining us on Gratuity. We really appreciate you taking the time out of your busy schedule, getting food to the front lines, to sitting down and chatting with us remotely and as safe as possible. So thank you.
Thanks for having us.
Yep, thank you.
What I've really seen, or what we've really seen in the last few weeks, is that chefs and other members of the hospitality industry are fundamentally problem solvers. You put something in front of them, whether it's service or opening a restaurant or raising something for charity, and they're willing to dig into that problem and find a solution. What have you seen with this industry and people who work around food coming together to solve the issues that have arisen from the pandemic?
I personally have seen a lot of incredible people doing a lot of incredible things. I think inherently people in the restaurant business are people who like to take care of other people. We like to give people an experience that they can remember, and we're struggling with that a little bit right now in our own restaurants. But I think we're also great at pivoting and shifting focus to greater good when it comes to really difficult situations.
You know, the World Central Kitchen is one of those organizations that's also been partnering with chefs to help solve problems through food issues in Puerto Rico and Haiti and America and things like that. Tim, can you share some of the insights of your inner workings of the organization, how you're able to mobilize so quickly, and maybe give a little background if anyone who's watching isn't familiar with what you guys do?
So World Central Kitchen, we started in 2017, founded by Chef Jose Andres. He went and responded to the earthquake in Haiti and saw that there was a need and a gap that he felt that could be filled by chefs being on the ground. You know, traditionally, a lot of the organizations that are the ones in charge of feeding for, disasters are generally, if they're not chefs, and as you kind of mentioned, is that chefs are amazing with adapting. We're quick on our feet, and we're able to get things done to get food out the door. We've been building up over the years, learning, generally respond to natural disasters, earthquakes, fires, obviously tons in California, hurricanes, things like that. This one, we've now been, since early February, we've been responding to this, the pandemic. We started out in Japan, serving a cruise ship that was quarantined off of the coast of Japan. And so this one is very different. It's been more logistical, aspect of things, but it's great with what we generally do because, as I said, really good at adapting. It's good for us to jump in, and we generally get kitchens up and running with less than 24 or 48 hours. And part of that is because we go in somewhere, with software as opposed to the hardware. So we don't need to bring everything in. We find existing kitchens, in the disaster, there's always an empty kitchen. There's always extra chef hands that want to help out. Right now, that fits as well, unfortunately, obviously a lot broader. So that's generally, using what's on the ground is generally how we can adapt so quickly.
And I'll just jump in. I will say that having worked with World Central Kitchen for a couple of years now, Tim, you guys have such an incredible network of chefs who are excited and not only willing, but so thrilled to be able to give back with your help. So thank you for all that you guys do.
Well, thank you for always jumping in.
Yeah, I mean, it's really inspiring and somewhat assuring to know that when there's a natural disaster or that some major occurrence happens, that you guys and chefs are now part of the solution, that you're going to be there to feed people, because a lot of the times food insecurity is the first thing to come up in these natural disasters or, a global pandemic. And you touched on it a little bit, but when there's a natural disaster, something like an earthquake, right? It is like a one moment in time. It's very clear of where the problem started, right? How do you pick where to go for a situation like that? Because there's obviously natural disasters happening all the time now. And then as a follow-up to that, like, how is the pandemic different in that approach? Because it's you could do one country, you could do every city in Italy. You could do, you could have been in China. You could just be focusing on the tri-state area in the Northeast. So it's a bit of a two-part question, but how do you pick it when it's a normal natural disaster? And then how are you applying that knowledge to something that is not centralized?
We watch a lot of the news, a lot of the on the ground. Twitter is an amazing tool to be able to see what's actually happening in real time. When things are happening like hurricanes, I don't want to say that they're great, but they, in our line of work, generally they are with planning, because you see them coming, you can start planning for them. We're generally on the ground ahead of the hurricanes when they hit, in the location that we're guessing that they are. Fires, earthquakes, things like that, we generally watch to see what the need is going to be. There's obviously, everywhere, there's so many amazing local organizations that, we kind of connect with them, the local governments, things like that, to make sure that there is going to be a need for us. We don't want to step on toes, but we also like to come in and help fill the gaps. If the local organizations are doing an amazing job taking care of shelters, people that are in need, great. If they start having trouble because the need is higher than what they're able to produce, or food that they're able to get to produce, then that's when we'll come in and we'll help out. This one, we are everywhere. And, I think I live in Los Angeles, and I was in Tokyo, back early February, was in Colombia immediately after, and then I may have gone home for maybe less than 24 hours. And now I've been in DC, which is where our home office is. So here is kind of like our central location where we're organizing everything around the world, really. We have operations that are set up in Albania right now, Spain. We're talking to some folks in Argentina, Mexico, Guatemala, Colombia, Venezuela. So, it's, and then obviously so many states throughout the US. Every single day here, it's been connecting with and talking to, the local chef partners that we have, the local governments, the local food banks. This one is extremely difficult because it's touching everybody, instead of like a hurricane or earthquake where it is, a little bit more centralized. So this one's been very challenging, but that's why, we've slowly been building up and trying to spread out as much as we can and touch as much as we can. It's not easy. I wouldn't say it was easy at all. As you said, though, as Brooke mentioned, we have lots of amazing chefs and partners like herself that, are always jumping in to help out. That's what's been making this easy, is to be able to have partners like that is jumping in and helping us.
It's also a matter of organizing efforts so that people aren't overlapping with their efforts to help get people fed, and that we're not ignoring entire communities and overserving others.
Part of why we've all gathered today is to talk about the partnership that you have going on with Help Feed the Frontline LA, because a lot of these doctors and firefighters, first responders, nurses, and things like that, they're doing these 12, 14, 16-hour shifts. And, food is a huge part of what's going to keep them going. So I'd love for you to maybe explain what the partnership is, who you're working with, just shine a little light on why you did this as well and why this was created.
This started really as a grassroots initiative where we learned from a friend who's an ER doctor, Lisa Miller at Kaiser, who said, we asked, how can we help, right? It was a group of parents and all of us wanted to do something. She was really clear that it was food. Well, we'd love to be able to have the infrastructure to deliver the PPE. It was really the food that was needed. A small group of us mobilized, and we very quickly realized that there was a significant infrastructure needed, and also this sort of delicate balance between the restaurants as well as these hospitals. So we very quickly rallied, and on the 24th, we launched our GoFundMe page, and on the 26th, we rolled out our first deliveries, and that was literally like our launch week, Thursday to Sunday. We delivered about 1,700 meals to 3 hospitals. The following week, which was last week, we delivered about 5,000 meals to 10 locations. So that was 8 hospitals and 2 fire stations. So we expanded beyond our initial footprint, which is MLK, Cedars, and Kaiser, to Santa Monica and Reagan, Little Company of Mary in Torrance and San Pedro, a couple fire stations, and Adventist Health White Memorial. This week, we're delivering 11,000 meals to 12 locations. We're adding ER and IC teams at USC and Peck to our footprint. Next week, we'll be at 14,000 meals. While that's an impressive sort of ramp up for a small group of parents, working parents who are not natural disaster specialists, what we learned very quickly is that the need is really significant and we're barely scratching the surface. So to put it into context, we're delivering about 800 meals daily to UCLA, but the staffing for just nurses alone is 2,500. So that's like 20% impact just at that hospital where we're actually really well deployed. All of this has been managed and enabled thanks to the donors. All of this is community funding and a few other significant partners. Obviously, Anthony Davis stepped up to match, which helped drive significant and amplify our participation from community members, and Bill Simmons donated $100,000. So we've had some significant donations.
Wow.
But we've also had, our first $50,000 was raised by small incremental $25 donations where people came to the table and said, I want to do something. I want to just, much like all of us, the parents who started it, it just said, what can I do, right? And to put it into perspective, $25 provides for 2 meals. So when you talk about this sort of 12-hour shift, 7A to 7P, 7P to 7A, many of them are working longer hours, but our current model is to deliver 2 meals, which basically is a lunch and a dinner that serves 2 hospital heroes in our minds who are covering a 24-hour shift. Many of that is again overlapping, exceeding 24 hours combined, and it's $25 out of pocket. So, but our partnership with WCK has been amazing because they've also allowed us to do 2 really important things. One, it's allowed us to offer a tax deductible receipt for all donations.
Amazing.
We have this giant infrastructure of compassionate people, but actually systems that allow us to expeditiously pay our restaurants. So all the dollars, with the exception of like a credit card fee, which actually most of our folks opt to cover, all of our funds are going directly to these restaurants who we care so much about. And where we started with 6 restaurants, we're now 17 restaurants and growing. And that's an equally important part of this sort of delicate ecosystem that we really want to nurture.
I mean, that's absolutely incredible to see that type of growth and commitment from people. Tim, to you, why was it important for World Central Kitchen to take this on? And is this a good model for people in different markets where they are cooking on the front lines and you're helping with the back end infrastructure?
As I said, since this is so widespread, I mean, the only way that we're able to help is by amazing partners. And, we're coming up on, right about, I think 1 million meals served in the last 2 weeks. That's just the US. That's not including, outside the US. But, hearing the story of them, 14,000 meals, that's a lot of meals to be doing as a small grassroots organization and ramping up to that. We're proud to hear things like that and proud to hear that that's partners that we're partnering with, because, I mean, we can't do it all like we can generally do in an isolated situation. It takes everybody. The more ground that we can help cover and provide meals for those heroes, because it is really difficult to see. And again, I keep saying about the isolated situations, but it just shows how different it is. Generally, that a typical natural disaster, it's going to be maybe like a 2-week period, 2 to 3 week period that is like the initial major response where it's all hands on deck. This one, we have no idea. I think I do keep referencing, and I do think I sound like I'm crazy every time, but it's like referencing zombie apocalypse. But it's like, a few months ago in Japan, never thought that we would ever be at this point, so it's hard to say what things will look like over the next few months. And I think we keep referring to it as this is a marathon, not a sprint, slowly building up, covering bases where we can, getting more partners, slowly bringing back on more restaurants online, taking care of more of the first responders and the hospital workers and everything. At the end of the day, also, it's ourselves, it's, the restaurants, it's, everybody that is involved with making all this happen. As they said, we all have families at home, and it's hard we have to keep ourselves in mind as well. But, it's obviously, as Brooke mentioned earlier, I mean, us being in the hospitality industry, it's as chefs, we're naturally, we want to nurture and take care of people. And so that's where this is our time to shine.
I want to talk about some of those workers because a lot of these restaurants have had to pivot to either shuttering down or doing delivery only, or you're seeing this now rise in people feeding either their communities through just food donations or charity works or something like this. Brooke, how have you worked with your kitchen staff or other kitchen staffs? Erin as well, feel free to jump in, how you're organizing both to cook this food, practice safety, really like organizing the cooking and delivery of the goods?
In terms of me, I have 4 restaurants, one of which is currently operating as a takeout and delivery venue. It's been an incredibly difficult time for restaurants. The people who are used to taking care of people are people now that are out of jobs. After the initial wave of having to lay off 99% of my staff, I have about 10 people left that I'm trying to keep on and keep with a stable, steady income for however long this lasts. And I will say that this supplemental hospital delivery income that we have is keeping those jobs viable. They're keeping those jobs alive. I've actually had to hire a couple of people back just to handle the influx of prep, while not at all forcing, obviously, anyone to work who is uncomfortable coming to work. There are a good handful of people who really just want to get out there and help. And this has really enabled an opportunity for people to come out and help and maintain jobs. And it's been a really positive thing. And if I am going to bring people to work, at least I know it's for more than just providing a meal to my immediate community, which is also important to me. But there are multiple reasons why I'm keeping people staffed, and it definitely keeps my head a little bit clearer in terms of looking at the bigger picture and the greater good of what we're doing. In terms of scheduling, it's different weekly, and it's a lot of pivoting and keeping things organized as much as possible. We are my husband and I are delivering all these meals personally, because I also, while I want to make sure that people have their jobs, I also don't want to put people in more danger than I have to. So my husband and I are taking that upon ourselves to do these deliveries personally, and we're staying as safe as possible, wearing gloves and masks. We've also, in the last week, partnered with Hedley & Bennett, which is normally an apron company, but they're now making masks, non-disposable masks, and we're helping distribute those. On the backside of things, Erin here has been scheduling all of the hospitals and rotating the restaurants with hospitals to make sure that no hospital gets the same meals two weeks in a row, which is
so nice.
Which is lovely.
So I'll jump in on that. We're mindful of sort of both sides of the equation, right? We want to serve nutritious meals. I think is worthy of even a larger conversation, just because it's beyond obviously the physical meal, but the emotional sort of nourishment that we're seeing, may be equal in value to these workers on the front line who are really working in wartime environments. But it's also really to sustain the work for local restaurants. So rather than just doing a one-off, we really wanted to bring on independent restaurants who, many of whom were facing, closing, having to lay off teams and not able to pay bills. And to our communities, they're so vital. When we approached this, we really figured out quickly that to do this at scale, it was going to be meaningful for both sides of the equation, right? The hospitals are getting inundated by this tremendous amount of goodwill, but it's difficult, right? They've all had to adapt as well to the new normal. And that means they have new people who are usually doing other jobs, who are now sort of responsible for trying to feed their teams because so many people want to help. So our ability to come in at scale has allowed them to just create a turnkey solution. So they're not trying to figure out how to plug 20 meals here and 30 meals here. We can come in substantially with a Monday, Wednesday, Friday delivery. But to build that infrastructure, we had to go through layers of administration. And those folks, various protocols have been given to us by each hospital, and they range from specific dietary requests to temperature controls, but all of them have a baseline requirement that each meal be individually packaged and produced in a certified and hygienic, COVID-19 compliant kitchen.
Sure.
But what that means for the restaurants is they have to be incredibly accommodating, right? This is a new normal for them as well. So the good news is they get to bring on staff, and what our design is, to Brooke's comment, is we want this to be sustainable for them as well. Unfortunately, this is not so acute. This is ongoing. And to the earlier comment, I think, was brought up, our goal was initially 4 weeks, and then we thought maybe 8 weeks. All the latest data suggested our frontline well into June in LA. What we're trying to do is, as we scale, bring on additional restaurants, but give them a reliable weekly schedule. That means they know what they need to do in terms of food prep. They know who they need to hire. But then they also have been incredibly accommodating from a price point, right? So we need to scale, we need some efficiency, but we also want to make sure we cover costs. No one's running to the bank with a lot of money here. This is really just the ability to keep the lights on. We're just truly trying to check every box to sort of keep the sustainability alive. But yes, we do also have a rotating weekly schedule, so that Brooke may go to USC one week and then she'll go to Cedars the next, and so on. And with her, in addition to the food, we're now in some cases bringing masks, because
That's amazing.
that's incredibly important. And, it's a little bit of what we call mission creep, but, we're really just here as sort of ambassadors of the community who wants to do, as much as we can, right, for our frontline workers. And I should note, LA has a tremendous amount of gratitude for frontline workers. We were all, not too long ago, displaced from our homes from natural disaster, from fires. I think the community in general has a tremendous sort of quick response and a huge level of gratitude to our first-time responders.
With that respect, the first responders have a tremendous amount of gratitude for the restaurants who are supplying these meals. I will say, not to interrupt, I just got a text from the team over at Cedars-Sinai. They literally just texted me this picture and said that we made their day. And I know that nobody in these hospitals are starving, but the fact that they are receiving nutritious, individually packaged, safe, sometimes warm, but definitely put together with care meals is really making such a mental difference in so many cases with these medical workers. And it's so nice that they have all been so responsive on how appreciative they are.
Yeah, I mean, it means a lot to feed people. It means a lot to take care of them. Do you have any other stories or anything that you want to share? Any response that you've gotten from people like that text that just shows how important it is to feed people in their time of need, especially when they're helping others?
I will say, just from the very outset, when I made calls to every single hospital in the immediate area, every single person, when I explained to them what we were trying to do, they would all pause. And I was sort of wondering if it was like a Zoom glitch, a technical, what was happening. Yeah. They all just were emotionally charged, right? And what I think what we forgot from sort of behind the scenes, sort of not on the front line, is how invested they all are sort of being on the front line. What that means is just they're constantly caring for others. So the idea that someone's suddenly caring for them, it's like an existential shift. Like they have no idea what it took them all moments to respond, and all of them, grown men and women, cried, equally, just saying, "I can't believe you're thinking of us." It was so shocking, right, that was what was going on. But it was also so revealing that they are full tilt working, their reality is very different. And so
and they're exhausted.
They're also, they're emotionally taxed. That was sort of a big eye opener, I think, for us. And the outpouring of sort of these emotionally charged sort of letters of gratitude. Some teams wrote thank you notes. We've had such an amazing sort of deluge of thank yous when, it's really all about them. We're thanking them.
I know. So if people want to get involved and donate money, I think people would be surprised the relatively low cost to get involved and how far that money goes. Can you break down the numbers a bit and also maybe talk about where people, if they want to go to donate, because look, money's tight for everyone right now. Like everyone is obviously thinking about their financial future, but also people need to feel that they're helping in some ways. In some ways, the easiest way to do that is to give money to the right cause, or give money to a cause that's actually putting food or service in front of people, or masks or something like that. So talk to us about the numbers, talk to us where people can donate and how people can get involved.
Just in terms of how people can get involved, it's very simple. We have our GoFundMe page, which all of those proceeds go to WCK. So everyone gets a tax deductible receipt, and we have a landing page. So WCK.org/Feed the Frontline. Those are the two easiest spots to go and donate. And literally $25 delivers a lunch and a dinner, feeds 2 healthcare heroes.
Wow.
$100 feeds 40 healthcare heroes, and so on. So any sort of small amount changes the day for 2 individuals. For example, to put 40 healthcare workers in perspective, that's 1 entire ICU floor at Cedars. They have 6. When this launched, they had 1 floor dedicated to COVID-19. That quickly became 2, and it looks like all 6 will be occupied. $500 would feed an entire floor at Cedars for the ICU team.
That's incredible. You guys are doing amazing work. And obviously, Tim, you and the World Central Kitchen have seen the beginning of trauma, the beginning of disasters, and gone all the way to the end, to when there is hope. And so I'd love to hear maybe from each of you, do you see a silver lining? Do you see us coming out together as a collective group of people or humans, stronger on the other side? How does this change all of us for the better in the long run?
This conversation that we're having and the 4 of us on here, I think that's proof that that's the direction it is going. I'm talking to so many chefs from across the globe, and they're getting involved with us and helping us with doing the meals for the frontline, you know, the first responders and everybody that needs a meal right now. Anybody that's helping, I've gotten so many responses from so many restaurants and chefs that have mentioned that, you know, I've been doing the restaurant business for so many years, and this moment right now, doing this and being involved with giving back in this aspect where that's all I'm doing is giving back versus, you know, feeding folks in the dining room.
Right.
You know, that this has completely changed their lives. So I owned restaurants for many years. A few years ago, I got involved with WCK, and as of last year, closed my last restaurant. On, you know, for me, it was the final straw was an online review that my ice water wasn't cold enough. You know? And so it's like, you know,
how dare you? How dare you?
I know. Oh my God. You know, but I had just come back from, you know, I forget which disaster, but I had just come back from,
Right.
you know, feeding people that have just lost everything. And that was that. And I was like, you know, I think I threw up my hands. I said, this is it. I mean, it does. It completely changes you. And it's going to be interesting to see how the restaurant industry, what is going to be changed with the restaurant industry. And also maybe people won't complain about not cold enough ice water, you know, and actually think about, you know, what the restaurants and the restaurateurs and chefs are going through right now. You know, hopefully there is that silver lining that we all come out of this better.
And I think that the strength and community that has become so built up in the last couple of weeks among the restaurant community and chefs and restaurateurs and everyone working in the food industry right now, I think that has to be one of the great things that comes out of this, right? Like, I have to believe, aside from maybe reminding people about how important it is to wash their hands and be hygienic,
Sure.
That the mission behind who we are as chefs and the difficulties that we endure in the restaurant business are maybe more present in the front of people's minds now, and potentially people will be more supportive and realize that in an industry that already has such tight margins, we are not in it to benefit ourselves. We're in it because we're passionate people about what we do, and we love helping others. And I think that that powerfulness of how much of a community we are stands stronger than it ever has. And I think that has to be one of the most beautiful things that comes out of this.
Yeah, and I would echo everything that was said. I would also say, you know, the quarantine has taught us a lot, but really how important community is. You know, particularly when you're trying to find ways to connect. And I think that that's actually bred a tremendous amount of creative thinking, particularly with restaurants, particularly with hospitals. As everyone has to sort of reinvent themselves to solve a problem. But to do that together is really the only way to do it. And so I think that we're finding is and it sort of goes to the small donations, it goes to sort of people just reaching across the aisle. It's sort of this notion of kindness and gratitude is so important. And this is a tangible way to actually exercise that and teach it to our children and demonstrate it to each other. But it also has really given us an opportunity to see how far we can come just by coming together under sort of with one mission. You know, it's really all about us, you know, as a community and caring about each other.
Amazing.
Which is so interesting that we've all found a way to come together stronger than ever.
Yeah.
In a time where we actually can't, you know, I've never met Erin in person. I love her to death, and I've spoken to her so many times over the last couple of weeks, and I can't wait to like have a cocktail and a meal with you sometime.
It's happening. That is another very big silver lining.
Yeah, I mean, the community building across national, international lines is it's really inspiring. And I can't thank you the three enough. We're going to have links in the description. People can read about what you're doing, donate some money. We'll have all the restaurants listed out. But thank you, Brooke, Erin, and Tim. Really appreciate it. And thank you for taking the time out of your really busy schedule and continue all the good work that you're doing.
Thank you.
Thank you so much. And hopefully we'll see you soon for a cocktail and a bite, right?
Yes, please.
All right. Bye, guys.
Thank you so much.
Thank you to Brooke, Erin, and Tim. We really appreciate all the hard work that you're doing. Again, if you want more information about what they're doing, there are links down below. We list all the restaurants that are involved. And if you want to donate some money, if you have money to spare, you can do it there as well. Also, if you want to get in touch with us, please drop us a line at gratuity@tastemade.com. Thank you so much, and we'll see you next time.